As many of you know, COVID-19 has hit close to home for us here at NBC News now. First, I caught the virus last month, which forced me away from the anchor desk for nearly a couple weeks, including over Christmas. Now my co-anchor Savannah is home after testing positive for the virus. Don't worry, she's feeling fine, but you don't need to hear it from me. We're going to bring her in right now to talk about her experience. It is so good to see you, my friend. What more can you tell us about what you've been dealing with?
Joe, I miss you. It's so good to see you. We've been talking, but it's good to actually get to be on the air with you. Yes, I am feeling okay is the headline. But here's the deal. So you may remember about a week ago, Joe and I were together in the studio, excitedly declaring that that time off wasn't actually a holiday, but we got to be back together. Well, I also had to quarantine during that time after anchoring with Joe, of course. And then after those few days back together, and after I even actually posted on Instagram that I stayed healthy during the whole time, then I actually tested positive. Now, there are nearly 21 million of you out there just in the US who'll know how that feels. I was freaking out. I was mentally retracing my steps and thinking about the very few people who I had seen and who I love very much. Would they get sick? Would I start to get sick? Well, then here's the next thing. The next day, I tested negative, and then negative again after that. And I don't think I ever really developed symptoms. I sort of thought I did when I had the positive test, but then of course they sort of disappeared with the negatives. But when I work out in my apartment here, of course, I think sometimes my chest hurts. So would that mean I had it or have it? I have a history of allergies, asthma, and anxiety, which is a lot to handle, by the way, on a good day, but is it one of those things? And the bottom line is I just don't know. They say the tests are accurate, but it could have been a misdiagnosis. And the other big thing is I know I had a better chance of knowing than most people do because of how much we're getting tested for work. And we hear about how difficult it is to get a test, how long it takes to get a result. And if I really was or am positive, that would have been a problem. I, of course, could have been spreading it. So the bottom line here is that this is all confusing, and we've learned so much about this virus since March, but there's still so many things that we just don't know. And as health officials learn how this works, they're updating the guidance we're all trying to follow. How long is someone contagious? When do symptoms usually develop? How long do we need to quarantine? Is it 10 days? Is it 14 days? In some cases, you might be isolating and feeling fine longer than someone who was sick with a mild case. So as you can, of course, see, I'm coming to you from home and sadly have not been anchoring the show because I'm so blessed to have a job where I can stay home to keep Joe and our wonderful staff and anyone's mom or dad or sister or brother who I might cross paths with to keep them safe and healthy. And I know so many Americans who actually feel sick can't afford to stay home, or they're scared to do so because they think they'll lose their job. And that's how this keeps spreading. So the biggest point I want to make out of my messy, confusing, stressful story is this: to take this as seriously as we all did in the spring when we were all Cloroxing our Amazon packages. We all remember that. But the vibes kind of changed. But we need to stay serious, stay home, wear your mask. And the situation is complicated, but the solutions are simple. And right now, for me, Joe, that solution means sitting here, bored a lot of the time, and certainly missing you and anchoring and our viewers, of course. But it's the right thing to do for right now. So that's why I'm here and why I haven't been on the show.
The bright side is you get to binge a lot of TV. I got a lot of shows checked off the list while I was not feeling well. I'm glad that you're feeling well. I'm glad your loved ones are feeling well. Clearly, this shows how seriously we are taking this, being as cautious as possible. I'm guessing you're going to be eager maybe a few weeks down the road to get an antibody test to figure out if you actually did have it or not.
Yeah, so that's a great question, Joe, and something that I'm going to be lucky enough to get to talk to Dr. Bob Lahita in just a moment and ask him about that. But I would love to do so. You know, that's another question I have because we've heard a lot about the accuracy of them. But, you know, so many signs are pointing to the fact that that could have been a false positive. I have no symptoms. Anyone that I did see, those few people, they've all tested negative and have no symptoms. But yes, that antibody test would be able to tell me, you know, did I have it? Do I have some level of immunity? But it just really is all it's convoluted, it's confusing. And I think the biggest thing is that it's just scary when you don't know, and when you don't know who you could be spreading it to around you. And for most of us, that's probably more of a concern even than ourselves, is spreading it to someone that you love.
Which is such a huge worry. So I know you have questions. Our viewers probably have questions after hearing your story. So let's try and get some answers to those questions.
Yes, absolutely. Let's bring in Dr. Bob Lahita. You guys recognize him. He joins us a lot. Dr. Bob, it's so good to see you. He's a professor of medicine at New York Medical College and chairman of medicine at St. Joseph University Hospital. All right, so doctor, I would love for you to help me understand. I know this is confusing. I know we might not ever understand, but I guess my first question to you is just about kind of the rate of these false positives. The type of test that we get at NBC, we're very lucky they're the PCR type of test, which we are told is very accurate. But then our doctors have also told me the signs surrounding it, the other evidence, like I just mentioned, could mean it was a false positive. So what do you think about that, and how often are you seeing that?
Well, we don't see that very often. If you do the molecular test, and good morning, Joe, and good morning, Savannah. If you do the molecular test, it's pretty accurate. Now, you know, you may fall into the group because, well, actually, both of you are quite young, and you would be asymptomatic and have the infection. And the CDC wants you to quarantine now for 7 to 10 days rather than the original 14 days. And then if you're asymptomatic, that is, if you have no symptoms for 48 hours, you're considered okay. You would get the test back. I know NBC would want to have you have the molecular test back, the PCR, which is quite accurate. Now, the unusual thing about that test is there are viral fragments that are picked up by that test. And so the test can be positive. It can be, you know, a little bit hazy going out of your symptom complex. That's fever, nausea, muscle aches and stuff. So that is, however, the most accurate test. The test that's called the antigen test that people get in the drugstores and things are accurate, but not as accurate as the PCR. And of course, you talked, Savannah, about getting the antibody test. You might want to do that because you should have neutralizing antibody in your blood. And that's called the IgG, immunized, actually, it's a neutralizing antibody that comes up after you've had the infection, as in contrast to other kinds of antibodies. So that should be easy to get done, and it will make you rest assured that you've had the infection and you've recovered. I suspect that both of you have had the infection, but again, because you're so young and because the majority of people below the age of 60 are somewhat asymptomatic, the majority, you'll do okay, and you should not worry.
And well, that's great news, Dr. Lahita. Thank you for that. So let me ask you, what would you tell anyone to do who's at home, which, by the way, it might be rare that people have access to testing like Joe and I are fortunate to, as I mentioned. But so what would you tell someone to do who tested positive and then never had symptoms and tested negative again literally the next day like I did? Of course, is the answer still to stay home?
I think the answer is not necessarily to stay home. You can probably go back to work if you're asymptomatic, you have no symptoms. But the key here is to be tested and to test negative. If you test negative on a PCR and you have no symptoms, then you're good to go.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.